Adrenocorticosteroids. Adrenal gland is formed of cortex and medulla. Adrenal cortex is concerned with secretion of glucocorticoids, mineralocorticoids, and sex hormones, or a small amount of sex hormones. Adrenocorticotrophic hormone is a peptide hormone secreted from anterior pituitary. ACTH is controlled by plasma cortisol concentration, feedback mechanism, and stress, where it is increased by fever and surgery. Actions: it stimulates adrenal cortex to secrete steroid hormones with little effect on aldosterone secretion. It is peptide, so it is not effective orally. It is used for diagnosis of adrenal function by estimation of 17 ketosterols in urine and by eosinopenia. And it is used for therapy as corticosteroids, especially in children and elderly, but of course not in adrenal insufficiency. We start by glucocorticoids. Actions: carbohydrates. They decrease glucose utilization, increase gluconeogenesis, increase liver glycogen. They induce hyperglycemia and diabetes mellitus. They deplete muscle proteins and increase liver proteins, and they have catabolic action on skin, muscles, and lymphoid tissue. They increase lipolysis and redistribute fats to face, shoulders, and abdomen. They produce sodium retention and hypokalemia. They antagonize vitamin D, so decrease calcium absorption. They produce euphoria and psychosis. They increase gastric acidity and decrease protective mucus, leading to peptic ulceration. They increase number of RBCs, neutrophils, platelets, but decrease eosinophils, lymphocytes, and increase blood coagulation. They increase uric acid excretion. They have anti-inflammatory action without affecting cause of inflammation. They inhibit leukocyte function, decrease capillary permeability, inhibit phagocytosis, stabilize lysosomal membrane, and inhibit phospholipase E2, so prevent release of arachidonic acid, so inhibit synthesis of both prostaglandins and leukotrienes. They inhibit antigen-antibody action, so they have anti-allergic action and immunosuppressant action. They have anti-stress and anti-shock action. And lastly, feedback mechanism. They decrease ACTH, and this will produce atrophy of adrenal cortex after long use. Cortisone is inactive. It is a product. It is converted into hydrocortisone, which is cortisol, and peak level of cortisol is from 4 to 8 a.m., the early morning. What about uses of glucocorticoids? Number 1, replacement therapy. In acute adrenal insufficiency, you give hydrocortisone sodium succinate IV, 5% glucose and 0.9% sodium chloride. Chronic adrenal insufficiency by cortisone or fludrocortisone oral. Supplement therapy in treatment of allergic diseases as anaphylactic shock, bronchial asthma, urticaria, etc. In autoimmune diseases as rheumatoid arthritis, nephrotic syndrome, systemic lupus erythematosus, ulcerative colitis, etc. In blood diseases as acute lymphocytic leukemia and hemolytic anemia. Anti-inflammatory in brain edema, in treatment of hypercalcemia and hypervitaminosis D, in resistant acute gout, some cases of chronic hepatitis, and of course in organ transplantation to prevent rejection. Preparations. Cortisol has anti-inflammatory and salt-retaining effect. Cortisol is inactive, it is converted into cortisol. Prednisolone is more potent anti-inflammatory and less salt-retaining than cortisol. We have triamcinolone and the paramethazone. They are potent anti-inflammatory and they have minimal salt-retaining effect. Dexamethasone and betamethasone, especially dexamethasone, is the most potent anti-inflammatory and it has the least salt-retaining effect. Beclomethasone and budesonide and fluticasone are inhalation steroids which are used in asthma. Fludrocortisone is a mineralocorticoid and has also glucocorticoid action, and it is the only mineralocorticoid which can be given orally. Adverse effects or side effects. If stopped suddenly after long use, they produce acute adrenal insufficiency. Sodium retention, weight gain, edema, hypertension, hypokalemia, and alkalosis. Diabetes mellitus, it is called steroid diabetes. Cushing syndrome, myopathy, and osteoporosis leading to pathological fracture, psychosis, peptic ulceration, delay healing of wounds and ulcers, hirsutism and irregular menses in females. They inhibit immune system, decrease defense body mechanism. This will increase liability or susceptibility for tuberculosis and fungus infection, especially moniliasis or candidiasis. They increase blood coagulation. They inhibit growth due to catabolic action on proteins. They may produce cataract and glaucoma. Precautions during therapy. You have to notice body weight, blood pressure, glucose in urine and blood. Radiological examination on the spine every 6 months to detect osteoporosis. Observe patients for peptic ulcer and hidden infection. Diet should be rich in potassium, calcium, proteins, and low in sodium, and give anabolic steroids to antagonize the catabolic action of glucocorticoids. Never stop suddenly. Use the minimal effective dose, and you have to increase the dose in cases of stress. Contraindications: peptic ulceration, viral infection, psychosis, active TB and acute infections. You have to give chemotherapy before. Osteoporosis, glaucoma, hypertension, heart failure, diabetes mellitus, pregnancy, Cushing syndrome, and sudden stoppage. Mineralocorticoids. Aldosterone produces sodium retention and potassium loss. It is controlled by renin-angiotensin system and level of sodium and potassium. Preparation: desoxycorticosterone is given sublingual or injection. It is destroyed in liver, so it is not effective orally. Fludrocortisone is the only mineralocorticoid which can be given orally, and it has also glucocorticoid action. It is used for replacement therapy in chronic adrenal insufficiency.